Clint, well, anyone who's been through IVF knows what a mental and financial battle it can be. And new data out in today's Courier Mail shows just how success rates can vary between clinics. Joining us today to discuss is Dr. Alex Izurieta from IVF Australia. Good morning to you, Doctor. Let's start with the really good news out of today, which is that more clinics are having good success in delivering babies to women in that older age bracket of, say, 35 to 42.
Yeah, no, it's great. It's great news. We've got a lot of technology that's come leaps and bounds in the last few years. So it means we can assist older women, couples with hereditary medical conditions, things that we probably couldn't tackle before, we can now. So the lab's technology really has assisted us in tackling these more difficult patients.
So this story out today has analysed the data from the IVF website that shows success rates for all the clinics. And it shows that the results can really vary wildly. Some clinics are delivering babies at 4 times the rate of others. Can you explain to us how that happens? Is it purely down to the number of women they treat? Is it some have better technology? What is it?
Yeah, well, a combination of things, really. Some fertility specialists are tackling more difficult patients. Other clinics don't have some of the technology that we can use to help these patients. So the demographics of each clinic varies. The variations that we see in smaller clinics can impact their success rates that we see on the website. But realistically, at the end of the day, it boils down to the individual and the care that they're getting with that particular specialist as to whether they're going to achieve their outcome as opposed to the clinic themselves.
I mean, it is an emotional roller coaster. Anyone who's been through it will know that. And it's also a huge expense for families. So when we look at these success rates, it's not just down to success, there's also a huge variation in how much clinics cost. What would your advice be then to somebody who's about to start the IVF journey?
I think really talk to their doctor. You need to have a relationship with your specialist that you can feel open about your condition. They can give you the best advice as to which clinics are going to be the best for you, or at least which technologies are going to assist them the best. And then try and tackle which clinic or specialist you're going to see. I think within any organisation, particularly the big ones, sometimes even second opinions are sought within doctors themselves. We have meetings where we discuss difficult cases as well. So it's not that they're left with one specialist in these big clinics. They are discussed over a panel of different specialists as well. I think the cost aspect of it is tricky. There are different clinics with different price tags, but that again boils down to the available technology that they have to assist the couples with their journey.
And if you're going through IVF and you're not having any success, should you try a different clinic?
Look, I think, it is worthwhile discussing with your specialist. I always sit down with my patients and say maybe a second set of eyes will give us a new take on, where we're at. I make recommendations sometimes for people to go and see other specialists. It definitely doesn't hurt. And it can help couples feel more confident in the care that they're getting.
All right, Doctor, thank you so much for your time and expertise this morning. Over to you, Clint.
Thank you, Jane.